Hello, my name is Brian Casey, Editor-in-Chief of AntMinnie.com. Now in its 21st year, the Minnie Awards are radiology's premier awards event, recognizing excellence in multiple areas of medical imaging, from most influential radiology researcher to Radiology Image of the Year. We have with us today the winner of the Minnies Award for Most Effective Radiology Educator, Dr. Ruth Carlos. Dr. Carlos is Editor-in-Chief of the Journal of the American College of Radiology, and she is also Professor of Radiology in the Division of Abdominal Radiology at the University of Michigan. Dr. Carlos, congratulations. Thanks for being with us today.
Thank you. It's a real honor to win this particular award for educator. And I have to share the award with the journal, the JACR, and with the rest of the editorial board. The journal has been such an incredible platform to expand our understanding of some of the contemporary issues that we have in the practice of radiology. And I am privileged to be able to champion the journal.
Great, well, it's well earned. Can you talk a little bit about what attracted you to radiology? And you wanted to be a physician from a pretty young age, correct?
I did, and then I went through medical school and I struggled with finding the right clinical niche for me. I had chosen to go into anesthesia, and I spent 2 weeks in between my third and fourth years on a quote unquote easy rotation in radiology while I worked on my anesthesia applications. And two people in particular, John Fennessy, a cardiothoracic radiologist, and Ruth Ramsey, a neuroradiologist, completely changed my life. They highlighted the diagnostic aspects, the sort of the whodunit of radiology, and that is really what attracts me to the field. How we can solve a problem with the best technology possible in order to take care of the patient.
That's great. It really highlights the importance of good mentors in radiology. What do you love? What do you love most about the field?
There are so many. The first and foremost is I really believe that radiologists have in their hearts the need to treat patients. And because radiologists aren't patient-facing, it can be easy to forget that there are physicians reading your films, interpreting your films, and taking care of you. And what I would like to emphasize is how we as a practice are working to change that perception to really reintegrate ourselves into the care of the patient. And we see this in multiple arenas, from screening all the way to treatment, particularly with some of the innovative work that's being done in interventional oncology.
Yeah, and that's kind of a big issue, like in the lay world, at least. A lot of people don't understand that radiologists actually are physicians, and highly trained physicians at that.
It can be a challenge. And what I do want to emphasize is that we work in tandem with our radiology technologist partners in order to be able to deliver the quality of care that patients see. Many of us chose radiology because we were attracted to the type of service and the type of care that we could provide. And we want to emphasize that, that we are part of the care team.
Now, how long have you been involved with JACR?
I started with the journal almost 10 years ago, initially as an author and on the editorial board. One of the duties of the editorial board at that time was to write a manuscript for the journal every year as our service. And I thought, well, writing the manuscript might be too hard, so instead I'll bring together 12 people and each one of them can write a manuscript, and all I'll have to do is organize. Little did I know that that work was both instructive and would prepare me for taking on this position. I then segued into being the deputy editor for the journal, and from there succeeded Bruce through the standard competitive process of editor selection.
Great. And this is Dr. Bruce Hillman, the founding editor of JACR.
Yes, who I count really as a friend and a mentor.
Now, you've been involved recently and have kind of directed some of the journal's approach toward issues like health equity. And can you explain a little bit what health equity is and what radiology's role in that is?
Our first health equity issue came out in 2018, way before the COVID pandemic, showed us that that our ability to care for the individuals are often are often influenced by the quality and access to care that they have. And that includes having the right type of insurance, finding people within the healthcare system who speak your language, who understand your culture, and who are able to present your medical choices with those in mind. I'd like to think about outcomes as an apple tree. And you can have people at different heights and different abilities to jump high to reach an apple. Equality would be providing everyone the same box height so that they can reach the apples. Equity is providing each one a different sized box or ladder to stand on so that everyone can reach an apple. And that's really what we're trying to integrate into our practice. One of the challenges with health equity, as with a lot of quality improvements and quality initiatives, is that it has to be supported by the institution and by reimbursement structures that align the value of equitable, efficient care delivery with appropriate reimbursement. And that is the challenge for caregivers of any stripe, whether you are a hospital system or a private practice group or an organization like the ACR.
Now, another issue related to health equity is this concept of financial toxicity. And if you can explain that a little bit, and how does that relate to radiology?
Any treatment that we give to patients has a set of side effects. So for example, for chemotherapy, you can have nausea and vomiting, your white cell count could go down, you could get infections. We don't talk about one of the greatest stressors to patients, which is the cost of their care. In our desire to give them the best and the newest, we expose patients to the cost of that care. And as we know, having insurance doesn't mean you have access to affordable care. The concept of financial toxicity is understanding that the impact on one's financial well-being is just as important to one's physical well-being and needs to be studied, attributed, and mitigated in the same way that we mitigate all other adverse events of care that we provide to patients.
Great. Well, it's really good that you're bringing that to the fore. It's something that radiologists should really consider as they try to move closer to patients. Now, this is RSNA week, and I trust that JACR has got some activities here during RSNA. Would you like to talk a little bit about that?
RSNA will have our usual tweet chat or tweet up that we do to bring the whole community together. The topic will be so timely that I haven't been told what that topic is, but do look out for it, and it will be at it will be on our social media, and we'll be sharing. And one last thing, the ACR hosted a call to action by a series of speakers around the topic of health equity led by Lucy Spoluto and Efren Flores, and that will also be part of the RSNA programming, so do look for that.
Great, perfect. Well, Dr. Carlos, thanks again on your Minnies Award. It's well deserved, and appreciate you being with us today.
Thank you, and I appreciate your time.
Sure. Have a great RSNA.
Thank you.